Hey guys, Dr. Dunbar here. I wanted to take a minute to kind of go over the pre-op phone calls that we need to do for our patients that need Mohs surgery. Understandably, our patients are sort of scared and confused when they get a diagnosis of skin cancer. So it's really important for everybody on our team to know kind of what is Mohs, why do we do it, how do we do it, what's the surgery day going to be like, and what the patient should expect. So there's a few things that we always sort of talk about with the patient. So the first thing is, Dr. So-and-so has diagnosed you with a skin cancer, and then you can tell them it's either basal cell carcinoma or squamous cell carcinoma. Rarely it's other kinds, but usually non-melanoma skin cancers get Mohs surgery. We say that, Mohs surgery is a special kind of surgery where we check all the margins in the lab the day of the surgery to give you almost 100% cure rate. It's the highest cure rate of any cancer surgery on the planet. So, I kind of frame it as, it's unfortunate that you have this cancer, but we're going to cure the cancer for you in the office on your surgery day. So that's kind of a way to reassure the patients that we're going to take good care of you. The thing to tell them is that, the upside is that the cure rate is so good. The downside is you can have to wait a long time in the office so that we can check the slides. It takes about an hour every time we check the slides, so it can be a very, very long day. So, so what do we tell? What do they need to know about their surgery? Number one, plan to be with us all day. We hope you won't have to be with us all day, but we like you to plan to be with us all day in case your surgery goes more stages than expected. I usually tell them averages 2 cuts or stages, so each cut or stage is about an hour. So that takes 2 hours, plus then you sort of have to wait your turn to get stitched up. So almost never are the patients in the office less than 2 hours. Every now and then they are, but I tell them don't make any plans, don't make a lunch date, don't book an appointment for afternoon. Just clear your calendar. Hopefully you won't be with us all day, but more than likely, you'll spend the vast majority of your day with us here at the office. So, how to prepare for being here all day? Eat a good breakfast. Lots of snacks, bring food and drink. I tell patients bring a little ice chest with you of snacks or lunch or whatever, because they can't leave. And a lot of times patients will ask, can I go get lunch? And what I try to do is have them know beforehand that, I really want you to, to bring the food that you need so that you don't have to leave. So that's an important thing. Be fed. When the patients are fed, they're happy. We'll have snacks for them, but they need to plan to bring some food. And then don't make any other appointments during the surgery day. So what's going to happen is they're going to come into the office, we're going to check them in and all that stuff, then they'll wait, we'll call them back, and I'll take my first layer. So this is an important thing that they'll ask about is, well, what does the surgery look like? Does he take a little slice? I tell people, so visualize like a Reese's peanut butter cup. Everyone's had those things, they're delicious. What I'll do is I'll remove a Reese's peanut butter cup, like a sort of a cup-shaped piece of skin around and underneath the skin cancer. And then what I'll do is I'll throw the chocolate away, because the chocolate's where the skin cancer is. We know the cancer's there, we get rid of that. What I want to see is the wrapper of that Reese's peanut butter cup. If that wrapper, so we take the wrapper, we lay it down, and we look at that wrapper under the microscope. If there's cancer still in the wrapper of the Reese's peanut butter cup, I know that there's still some roots, and I'll have to take a little bit more. Then it's the same thing. You take another peanut butter cup shape of skin and look at the wrapper again. We do that as many times as we have to until there's no cancer left at the edges, or, so in this analogy, in the wrapper. So that's kind of basically all we do. We remove chunks of skin, probably wouldn't say chunks, but we remove pieces of skin until the margins are clear. When the margins are clear, we know the cancer is cured, and then what we'll do is we'll get you stitched up. And a lot of patients say, well, will I need plastic surgery? And so what I tell them is, well, I'm not a plastic surgeon. I'm a dermatologic surgeon or a Mohs surgeon, but I do have extensive training in sort of doing skin cancer reconstruction. All I do all day is stitch the skin, so I've done it thousands of times. Some patients will say, I don't trust this guy. I want a plastic surgeon, and we can facilitate that. I will say that typically Mohs surgeons stitch on the skin much more than most traditional plastic surgeons. So normally, we don't want to twist anyone's arm. We want everyone to feel comfortable getting taken care of the best way for them. But we normally try to tell patients that you'll get the plastic surgery in the office the day of the surgery, and it is plastic surgery because we're moving skin around, even though I'm not technically a plastic surgeon. So that's kind of a sticking point that some patients who think plastic surgeons are sort of the greatest thing ever, they'll get sort of stuck with. But so those are the main things. Tell them to plan to be there all day. The other thing is we sort of manage their expectations. So they'll say, will there be a scar? And I tell them there's always a scar. Every time we do any kind of skin cancer surgery, anytime we cut on the skin, there's always some evidence that we were there. But what I'll do is I'll do everything in my power to minimize the appearance of the scar. A lot of times we can camouflage the scar, put it in the natural skin lines or do a skin flap to minimize the scarring. There's a lot of tricks we use, and I do everything I can do to minimize that scarring. Other things, there's going to be a Mohs pre-op questionnaire that we'll have to go through with all the patients when they're scheduled, or at least 2 weeks before their surgery appointment. The main thing for that is we want to stop their blood thinners if they're able to. Now, that means if they're on aspirin for prevention of a heart attack, like they've never had a heart attack, they've never had a stroke, they don't have any heart condition that requires aspirin, if it's just for prevention only, I really want them to stop that. Aspirin causes a lot of bleeding, and that makes my job harder, which makes the patient's surgery day a lot harder. So minimizing blood thinners. So aspirin's the worst. Typically, if patients are on Plavix or Coumadin, those are other blood thinners, but they're usually on those for very good medical reasons. Sometimes they'll know that they can stop those blood thinners, but typically I don't ask them to stop their medically necessary blood thinners. Other things that patients don't realize: Advil, Motrin, Aleve, ibuprofen, Excedrin, headache powders, all that stuff really thins out the patient's blood. So what I usually say is, are you on any pain relievers besides Tylenol? And a lot of patients are like, well, I take Advil occasionally, and then you'll say, well, when was the last time? And they'll say, well, yesterday. So people who take Advil take a lot of Advil, I find. And stopping the Advil at least 2 weeks before surgery, again, makes a huge difference. So stopping aspirin and the non-Tylenol pain medications 2 weeks before surgery or more is really helpful. Now, if they have surgery scheduled in 3 days, we haven't gotten them on the phone, finally we get them on the phone, they say we take aspirin, just have them stop as soon as possible. We don't normally have to postpone the surgery unless it's sort of a disaster, a huge skin cancer or something. But typically, if we can have them stop 2 weeks before the surgery, that's going to be much safer and better for the patient. I really rely on the people who are doing the pre-op phone calls to stop those blood thinning medications. And it's very helpful. If there's any questions, you're always welcome to ask me. Other things, so multivitamins, fish oil, any herbal supplements that the patients take. We have to ask about these things now because a lot of patients are taking vitamins and supplements, fish oil, all that stuff. Those all need to be stopped 2 weeks before the surgery also, because those also thin your blood a tremendous amount. So those are sort of the main things. There's other things. We always have to ask about history of joint replacements or artificial heart valves, or if the patient has taken antibiotics before they go to the dentist. If they have a good reason that they need to take antibiotics before the dentist, or they have a heart valve, or they have a joint replacement in the last 2 years, I normally start some preoperative antibiotics. My normal antibiotic is Keflex, and we'll sort of talk about that more. But those are sort of the most action step, crucial pre-op screening questions. It's preparing the patient all day. Is there going to be a scar? Yes, there's going to be a scar. I'm going to do everything I can to minimize that scar. Do you take aspirin? Can you stop it? Stop it. Do you have a reason for antibiotics? Okay, let's get that prescribed right now. So those are the sort of things that we can do before the patient even comes to the office for their surgery that's going to make their day go much, much better. So these are the things we're sort of working on. If you have any questions, text message, email, anytime, any member of our team, I always welcome them to sort of contact me. And in my opinion, there's no such thing as a bad question. The only question that's bad is one that doesn't get asked. So I never get upset if people have questions for me. So please let me know what I can do to make this easier. We're working on building the template of NextTech, and we'll get that done really soon. But until then, good luck calling the patients. Please let me know if I can do anything to make it easier. Thanks a lot.